Doctor, how has this procedure changed the way you practice medicine?
So I think it's giving us an opportunity to help patients where normally we didn't have something to offer them. So that's obviously good for patients. On a personal level, it's been very gratifying because the results have been so good. I'm thinking about a patient I just saw this week who I treated with CyberKnife to his lung about a month ago. And the first CAT scan that we got of him only a month later has already shown that his tumor is completely gone. Now, that's not to say that every single patient's got that same result. But, you know, as an oncologist, you're so used to oftentimes having to give bad news to people. It's very gratifying when you can give people good news.
Absolutely. I want to reiterate some of the benefits of CyberKnife, and I know we did go over some of these. One being it treats patients with 1 to 5 visits, pain-free and requires no anesthesia, like you had said, and it's an outpatient procedure with little or no recovery time and minimal side effects, and no overnight hospital stays required. And this is one of the things that I think people may be really excited about. It allows them to return to their normal activities. So it's, you know, virtually, you know, something, like you said, pain-free.
Right. So, you know, you have no restrictions on you other than your other medical problems dictate. You know, we have people that come in, have their treatment, and then go to work. It's an outpatient procedure. There's nothing restrictive. You don't have to have someone else drive you. You can do this yourself. It's really quite easy on the patient while they're going through the procedure.
Now, talk to us about some of the types of cancers this can treat, as well as non-cancerous tumors, I would imagine.
Sure. So virtually anywhere in the body, specifically if you're talking about patients who have metastatic disease, but largely primary treatment of lung cancer, prostate cancer, pancreatic cancer. You may have heard in the news Patrick Swayze had this treatment for his pancreatic cancer. Malignancies of the brain, non-malignant tumors of the brain, meningiomas, trigeminal neuralgia, which is a very painful neurologic disorder. We talked about lung. Prostate cancer is very big. Certain types of recurrent gynecologic cancers are also candidates. We could go on and on and on.
So it's well-rounded uses, so to speak. I want to go back to some of the benefits and talk about some other benefits in which we started to mention that it constantly corrects tumors and patient movement throughout the procedure, so it's constantly working with the body, and then it minimizes radiation exposures to healthy tissue surrounding the tumor site, which I can imagine is very important.
Right. So if you look at, again, I'll use this comparison I keep going back to of the older way of doing it. In order to get a very high dose of radiation to a tumor, you had to give a lot of radiation to the surrounding normal tissues. And that was because you were delivering the same amount of radiation, let's say in 4 to 5 different angles versus 150 to 200 with the CyberKnife. So by giving a little bit of radiation through 100 or 200 small pencil beams of radiation, which converge on that one spot, you're really eliminating that toxicity that you were getting on older types of treatments.
So it's virtually, you're unlimited to how you can, so to speak, attack the tumor.
Exactly.
Which, and it's all with the use of this arm.
Correct.
What has been the best thing for you as a doctor with this new technology that's come out?
I think it's been what we touched on earlier, patients that felt like they had no other options, that couldn't have surgery, being able to offer them this as a definitive management, not just as, well, you know, they can't do anything else for me, let's do CyberKnife, you know, I'm not going to be cured. I think the literature supports that for lung cancer and for prostate cancer, that you can cure patients with this.
Okay.
And that's very rewarding.
We have to take a quick commercial break, but don't go away. We have more with Dr. D'Ambrosio when we come back. Thanks for staying with us here on Eye and Ocean County. I'm Christina Seco. The CyberKnife program involves no cutting and no anesthesia, and it requires no recovery time or hospital stay. Joining me once again to discuss more is Dr. David D'Ambrosio, radiation oncologist and medical director of the CyberKnife program at Community Medical Center. Thanks again for being with us. And we're talking about, you know, what this does and how it works. Is it covered by insurance?
Yes, it's covered for, obviously we only use the CyberKnife for what it's medically indicated for, and we accept all insurances, and it's covered by most of them for all indications.
Okay, and this seems like it's only like a piece of the puzzle. So what else for other candidates that may not need the CyberKnife? How are they treated at community medical center?
So this is a piece of the multidisciplinary cancer care that we have at community medical center. As part of the J. Philip Sitta Regional Cancer Center, we have the designation of a community cancer center, which is a good thing for the community because it talks about that we're not only just a radiation oncology program, we have medical oncology, we have social work backup, we offer transportation services to people, pet therapy. It's a very well-rounded program, and it's the type of program that myself and my partners were grown accustomed to when we were at the academic centers in Philadelphia. And it's very rewarding for us that we're able to provide this for the community in a non-academic setting and really not miss a beat. Not everybody is a candidate for CyberKnife, and we have other machines in our department too. We have a brand new what's called a linear accelerator, a Varian Rapid Arc Trilogy machine, which basically can treat everything that a CyberKnife can't treat. Not everyone's a candidate for a CyberKnife, but most people can be treated on that. And it's a very good machine, and for people that have the indication for treatment on that, it's something that we're also very proud to offer patients.
And we have a picture here on our screen of the Rapid Arc radiotherapy machine that you were talking about. What would make someone not a candidate for CyberKnife and to use this one instead?
Sure. So for certain types of cancers, let's say somebody who presents with a new head and neck cancer, a tonsil cancer, or a throat cancer. Those aren't patients that should be treated up front with CyberKnife. They should get standard radiation with the Rapid Arc.
Okay, so there's definitely a line between who would need it and
Sure.
not. Some of the other services that you had mentioned, you had talked about the medical oncology and the surgical oncology. You also have support groups, which are definitely just as important in treating cancer as helping the family as well. Talk to us about those
Sure.
options.
We have a very good social worker in our department, Sherry Lenato, and she organizes several support groups. And I always encourage my patients to join the support group because when you get a diagnosis of cancer, it could be a feeling of aloneness. And being able to talk with other people going through similar experiences or people that have already gone through these experiences, I think is a very valuable part of their treatment. There's something to be said for having a patient who is at peace with what they're going through and not anxious. I think that helps them recover.
Absolutely. Now, Community Medical Center is a member of the Penn Cancer Network. What does that mean, and how does that benefit the patients directly?
So there's a few benefits to that. One is that we have immediate access to the University of Pennsylvania and all of their resources in terms of clinical studies, in terms of being able to refer patients there where it may, let's say, a surgical case, which is not particularly, it's a particularly rare type of tumor that we need some expert opinion on. We have those resources. And patients who are seen at Penn, they know our cancer center very well, and they can feel comfortable telling the patients from our area that they can come to community for their treatment. And just as important to that program is our ability to offer patients enrollment on clinical trials. And we do have a very active clinical trial program, and we have many studies open for both the CyberKnife and our standard machine, as well as medical oncology. National and international studies open to patients, so they don't have to feel they have to go to Philadelphia or to New York in order to have access to these programs.
And how would patients get involved in some of those programs?
So they could ask their doctor, and they could direct them to us. We have a dedicated nursing staff to the research program. They can go on our website. They can go through the hospital website itself, or they can go through NewJerseyCK.com, which also links through to the community website. So there's a lot of information there that patients can get on.
Now, Community Medical Center is a regional cancer center, what exactly does that mean for somebody at home that may not have known that?
Sure. So what that means is that we go through a very rigorous process every year where all of our patients are reviewed, and we have to meet certain criteria and certain standards of excellence that give us that designation, we have to show that we're putting patients on clinical trials, that we're presenting patients at multidisciplinary tumor meetings, tumor boards, which we do every week. This is not something that's just easy to come by, and we're very proud of it.
Absolutely. Now, what would you say to a patient, a cancer patient that may be thinking about using the CyberKnife, but will say to themselves, this is a new program, I'm not so sure I want to go with this? I mean, kind of ease their fears. What would you say to them?
Well, I think the best thing to do is to just call us and talk to us. Our phone number for our CyberKnife is 732-557-3120. And we have a nurse navigator, Debbie Moriarty, who is an oncology certified nurse. She has many, many years of experience. And she can even over the phone talk to you a lot about CyberKnife and whether or not she thinks you would be a candidate. And having a consultation with me, it's also going to be helpful. I'm not going to force you to do anything. I'll discuss your options with you. If I don't think you're a candidate, I'll tell you you're not a candidate. But really, I think you need somebody who has the level of expertise to discuss it with you. And don't be scared. Don't be scared to call on your own. These are newer technologies, and even your own physicians may not be up to date on all the latest treatment strategies. So be your own healthcare advocate. I think that's very important for people these days, to be their own healthcare advocate.
Alrighty, thank you so much for sharing that information about the new CyberKnife program. Thank you for coming on the show. And for more information, of course, you can log on to NewJerseyCKforCyberKnife.com. Thanks for joining us, and we'll see you next time.